on Nevada Ryan White Universal Eligibility and Enrollment 101. The webinar is hosted by Natalia Trodal of the Ryan White Part A Grantee Office and Samantha Penn of the Ryan White Part B Grantee Office. Ryan White Parts A, B, C, and D in the state of Nevada have worked diligently to simplify the eligibility and paperwork process for clients accessing Ryan White services in Nevada. Utilization of the common guidance for Ryan White eligibility guidelines and documents permits a more streamlined process for easing the provider burden while facilitating easier access for clients to engage in Ryan White Parts A, B, C, and D services in the state of Nevada. The eligibility guidelines and paperwork for each Ryan White part are universalized, where clients are able to complete their eligibility with a single application. Eligibility specialists from each agency will meet directly with applicants to assist in completing the universal application and gather pertinent documentation for eligibility. Agencies will continue to use the client-level data management system, Careware.
During this transition, you can expect to learn about universal eligibility enrollment for the Ryan White Parts A, B, C, and D. Following this training, you should be able to identify the different types of enrollment appointments, explain the differences between full and provisional eligibility, identify acceptable forms of identification, identify acceptable forms for proof of diagnosis, proof of residency, and proof of income level. Discuss the requirement for collecting labs and verifying existing insurance coverage. Locate and identify existing common guidance documents, and discuss the ADAP referral process.
Depending on what type of enrollment appointment the individual is in, there are different combinations of requirements. There are 4 types of enrollment types: brand new client, annual enrollment, recertification with changes, and recertification without changes. The first thing you'll notice on this slide is the Ryan White registration letter. The registration letter should be the first document that any eligibility specialist sees when reviewing the packet. This is now document 1. There are 2 registration letters. One is pending or provisional enrollment, and one is a full enrollment. Each time that you upload a document, place the registration letter in front of it. So, if a client comes in and gets provisional eligibility, the registration letter will reflect the documents that are missing, and behind it will have all of the documents that the client does have at that time. Now, let's say that a client comes in 2 days later with the proof of income they were missing. You're still going to have the registration letter and any documents that apply to that letter behind it. Every packet uploaded should have the registration letter, letting the next person know what is included in that packet. The next item on the list is the application. The application is a required document and must be included in the packet. We also require proof of identification. The client only has to provide it one time. If the client enrolled 2 years ago and there is ID in that packet, they don't have to provide it again. Other required documents are the Notice of Privacy Practice and the Enrollment Documentation Checklist, which indicates which documents were used to qualify a client under each section. Proof of diagnosis is only required one time for a brand new client. Once an individual has been diagnosed, that status is not changing, so there is no need to continue to ask for it. Item number 8 talks about labs. Labs cannot be older than 1 year from the date of the eligibility appointment. There are usually 3 dates listed on labs. You want to look for the specimen collection date, which is the date the blood sample was collected. The time between this date and the client's enrollment appointment cannot be more than 12 months. If you have a client that brings in expired labs, it is your responsibility to instruct the client that new labs are required. 2 proofs of residency are also a requirement. Addresses must match on the documents. A client cannot provide a document with an old address and a document with their new address. A client can use ID as proof of residency, but the ID cannot be expired. Proof of income level must also be collected. If the client has a spouse, their income must be collected. Any household income that would be included on their taxes must be documented. Item number 10 is the household composition form. This document captures everyone living in the household. We also need to capture insurance information for a client. Form 1610 is a survey of existing insurance coverage. This form lists all of the different types of insurance situations for a client. This form is also where an eligibility specialist indicates if a client needs any ADAP services, such as insurance premium assistance or medication assistance. Insurance cards are required, but only by Access to Healthcare Network, also known as AHN. Access to Healthcare Network is the administrator of ADAP. Include other documents in the packet when appropriate. Lastly, you will finish with the release of confidential information, which allows all of the providers within the Ryan White network to share client information. The items you see listed in purple on this slide are all of the common guidance documents. That is what CGD means. This means that they are universal between all Ryan White parts. Parts A, B, C, and D all have the same documents. It does not matter which website you go to, you will find the same documents.
Documents required at the full annual enrollment appointment are the exact same as those required for a brand new client. The only items that are not required are the proof of identification and the proof of diagnosis, as those would have been collected during the client's initial eligibility appointment. If a client is brand new, you would only collect all of the documents, but each time after that, you would only collect the other documents and no longer ask for ID or proof of diagnosis. A client must recertify at the 6-month mark. There are two types of recertification: recertification with changes and recertification without changes. Both appointment types require the registration letter and the self-attestation form. The registration letter, as discussed earlier, indicates whether a client is granted provisional or full enrollment, and also provides the date of eligibility. The self-attestation form asks if the client, if any information has changed within the last 6 months. If the client indicates that yes, something has changed, the client is required to provide the document corresponding with that change. If there are no changes, the client indicates this on the form, signs it, and along with the registration letter, is uploaded into Careware. The documents listed here are the only documents collected and uploaded. All other documents and forms will be collected annually. Items not required during this appointment are proof of identification, proof of diagnosis, labs, or backup documents of any information that did not change.
Moving on to provisional enrollment, we would like to spend a few minutes focusing on the parameters for provisional enrollment, as many questions often come up for this. Eligibility and enrollment specialists can collect the minimum documents required for 30 days of provisional enrollment and initiate the referral process for ADAP medication if needed. Eligibility and enrollment specialists are to input into both Careware ACD and Careware B the client's provisional enrollment status with provided documents so that the client is able to receive services at other agencies. No services can be denied to a client who is currently provisionally enrolled in the Ryan White HIV/AIDS program in Nevada. Clients may be given a provisional enrollment period for the completion of the certification process. A 30-day provisional enrollment period will be allowed for clients who are pending all eligibility documents. The provisional period begins on the date of their initial eligibility appointment. Staff must complete the annual review screen in Careware to ensure that other agencies know what documents are pending and the current eligibility specialist working with that client. When clients finalize their eligibility, the 30-day provisional period is included in the 6 months. For example, a client is pending from January 1, 2013 to February 1, 2013. The client will need to recertify by July 31, 2013. If the client brings in all documents except labs, we give them 60 days of eligibility. We are giving the clients in this situation extra time to see a doctor and to get their labs. In cases where a client does not have insurance at all, they would need Ryan White services to see a doctor. The Ryan White HIV/AIDS program, Parts A, B, C, and D, have determined the minimum required documents for provisional eligibility. You will notice that this list of items looks very similar to what is required of clients at the brand new or annual appointment, with the exception of a few documents. The items in black are literally the only things that a client brings with them to this appointment. The remaining items are provided by eligibility specialists. The registration letter is still required and is found online. The application is required and can also be found online. This is not something the client brings in. The eligibility specialist verbally reviews the application with the client to obtain the necessary information. We do ask for proof of identification for brand new clients only. Ongoing clients do not have to provide this. The privacy practice acknowledgement requires a signature from the client. The document checklist can also be found online. The client must bring with them at least one proof of residency. The MAGI worksheet or the modified adjusted gross income sheet must also be included in the packet. A question that comes up often is if a client states they do not have income, do they still complete a MAGI worksheet? The answer to this is yes. We need to see that the client has no income. You would cross out the information and put a 0 where it asks for income. This allows us to see that the specialist inquired about the client's income status and did not just forget to ask. Proof of household size, survey of existing insurance coverage, and the release of confidential information are also required. During provisional status, a client can access all Ryan White services, including ADAP, since the requirement for all Ryan White parts are the same. Access to Healthcare Network, or AHN, may require additional documentation when assisting with medication, but this would not count against a client's eligibility. A frequently asked question has been, if a client is missing several documents as well as labs and do not bring in all of the documents within 30 days, can they be extended to 60 days since they are also pending labs? The answer to this is no. A client is only granted 60 days of provisional enrollment if they are only missing labs. If, at the 30-day mark, they are still missing other eligibility documents, their eligibility would be terminated and the client would have to start the process all over again. Form 1625 provides guidance on what to look for when determining if a client meets criteria or for full enrollment or should be given provisional status. The Ryan White HIV/AIDS program, Parts A, B, C, and D, have determined that the minimum required documents for provisional enrollment at the recertification appointment include the registration letter, 6-month self-attestation form, and 1 proof of residency if the client's address has changed. If nothing has changed, just complete the registration letter and the 6-month self-attestation. Provisional enrollment still means they get only 30 days of eligibility.
Now we're going to review each of the required documents that clients are required to bring in, starting with proof of diagnosis. The Ryan White HIV/AIDS program states that an individual eligible to receive assistance from the state shall have a medical diagnosis of HIV/AIDS. Acceptable forms of proof of diagnosis are as follows. Number 1, a Western blot test. Number 2, letter on a physician's letterhead with a signature of a clinician indicating that the applicant is HIV positive with a diagnosis date. Electronic medical records can be used as proof of diagnosis as long as it says electronically signed with the doctor's name and date. Number 3, a positive HIV immunoassay and a detectable HIV RNA. Number 4, 2 different positive HIV immunoassays. And number 5, request a proof of diagnosis form completed by the applicant's physician, Common Guidance Document 1539. As you can see in the blue bubble on the right side of the screen, only one of the documents is required. As long as the documents fall within one of these categories, you can accept them from the client. A question that has come up regarding providing diagnosis of HIV is that if it's discovered that a client does not have proof of diagnosis on file, but is an existing client, are they grandfathered in or do they need to provide proof of diagnosis? There is no grandfather guideline or policy for existing clients whose proof of diagnosis cannot be located in their file in Careware. Once you determine that this cannot be located, the client becomes provisionally eligible for 30 days and must bring proof of diagnosis within this time frame or they will expire. There are no exceptions. At any given time, the grantee should be able to pull a client file and easily access their documents showing HIV diagnosis. If you are ever presented with documents and are unsure if they meet criteria, contact your respective grantee office for further guidance. Proof of identification must be on file for the client. Once it is collected and documented on file, you do not need to continue to ask the client for their ID. Acceptable forms of ID will have the client's picture and name on it. These are the 2 most important elements for an ID. The following forms are acceptable. Number 1, a Nevada driver's license. Number 2, U.S. or foreign passport with photo. Number 3, permanent resident card with photo. Number 4, a local, state, or federal government-issued card with a photo. School IDs are acceptable because they're issued from the school district, which is a local form of government. Number 5, a consulate card with photo. Number 6, a resident alien card with photo. The ID must be uploaded into Careware. Only the front of the ID card is needed. Scanned copies of the ID must be clear and legible. Color copies are preferable, however, it's not required. If IDs are uploaded in black and white, this does not hold up a client's enrollment status, but please make sure that the client's photo is clear.
All applicants and clients are required to provide CD4 and HIV viral load information once a year. The labs brought to the first or annual appointment must be no older than 1 year from specimen collection date to appointment date. Again, we are looking for the specimen collection date. If the client is in provisional status and only labs are missing, the client will receive 60 days of provisional eligibility. Now moving on to proof of residency. There are several items that can be used as proof of residency. A client must provide you with 2 proofs of residency to receive full enrollment. If they only provide 1, then they get 30 days of provisional status. The following is a list of acceptable proofs of residency. Number 1, the client can bring in their current rental, lease, or lease agreement. Number 2, the client can bring in their rent or mortgage receipt, even if it is written on paper. 3, any bill, invoice, or statement. Examples of this include a water bill, a Medicaid statement, a cable bill, pay stub, or bank statements, just as long as it has the client's address on there. Number 4, a letter from a government agency, voter registration or vehicle registration, prison release papers as long as they have an address on them, current Nevada driver's license or state ID card, consulate ID card, resident alien card, other verifiable government ID with an address, and number 11, proof of property taxes paid. Items 12 through 14 are the common guidance documents that can be used. If a client can use one of these documents, they're only providing one of these. Number 12 is the verification of residence, or common guidance document 1550. A client and the person they are living with would sign this form verifying that the client is residing at their address. 13 is the dependent support form, or common guidance document 1548. A client and the person they are living with would sign this form verifying that the client is residing at their address. Number 14, the non-stable housing declaration, or common guidance document 1544. The client is declaring that they are not stably housed on this form. The receipt, invoice, letter, or form must not be older than 30 days. The ID card must be unexpired. The copies of the ID scanned into careware must be clear and legible. Color is optional. Only the front side is needed to be scanned. Addresses must match.
For proof of low income status, clients will provide what is most applicable to them. They can provide any of the following. Number 1, copy of their most recent pay stubs for the last month. Number 2, a copy of the most recent annual disability statement, SSI, SSDI, retirement, pension, VA, child support or alimony, unemployment benefit statement, etc. Number 3, 1 month of bank statements. Only if pay stubs or an annual statement could not be provided. Number 4, a prepaid debit card statement. Number 5, a profit and loss statement for self-employment, Common Guidance Document 1604. Number 6, a verification of no income, Common Guidance Document 1545. Number 7, the Dependent Support Form, Common Guidance Document 1548. Number 8, the Household Composition Form, Common Guidance Document 1606. This is always required. Number 9, the Magi Worksheet, Common Guidance Document 1552. This is also always required. This form is included even if the client has zero income. Brand new and annual clients must provide all that is applicable. During the recertification, clients need only to provide documents if information has changed since their last appointment. Existing insurance coverage is the only form required for this section. It asks if clients are eligible for Medicaid, Medicare, Marketplace insurance, or other insurance. We are looking to determine the client's existing insurance coverage. It will also ask if the client is part of the VA or Indian Health Service. This form was recently updated, so please make sure to grab a new one from our websites. One of our program's requirements is that Ryan White is the payer of last resort. This means that we have to ask if the client has any other payment sources other than Ryan White. There is a policy, Policy Primer 1610A, that explains the Form 1610 and the changes related to the vigorous pursuit of minimal essential coverage policy requirement in Policy 1708. These policies provide details for when a client can opt out of being referred for coverage.
This slide provides a list of all of the common guidance documents. Again, these documents are the exact same documents across all parts, A, B, C, and D. The title of the document is preceded by a number. The items in bold are the documents that are required to be included in each packet. Please make sure you're using the most current version of this form available on Part A and Part B websites. The Consent for Release of Information, or ROI, has been updated to reflect new providers. New updates are highlighted in yellow. Anytime we start a new grant cycle, there may be new providers that will need to be added. The client is giving their consent to all of these agencies so that their information can be shared within CareWare and across providers.
This chart shows how to determine a client's 6-month eligibility period. The column on the far left is the window for the client. For example, if a client comes in between April 1st and April 30th, their eligibility end date would be October 31st. You are always ending on the last day of the 6-month period. The exception to this is provisional eligibility. For provisional, you are giving the client 30 days exactly from the date of their initial appointment. Once the client brings in their documents, the client's enrollment period is extended to 6 months from their initial appointment date. If a client comes in early to do their eligibility, the new period of eligibility would start on that date. So in the first example, if a client is not due to renew until October 31st, but comes in August 15th with all of their documents, the client's new start date would be the date of that appointment, August 15th, and they would have the new end date would be the last date in February 28th or 29th. Ryan White Parts A, B, C, and D no longer utilize retroactive eligibility. A client's eligibility start date begins when a client has met the minimum documentation for provisional or full eligibility. Part B only. Early intervention services, medical case management, and non-medical case management services that are delivered to clients within 30 days of an eligibility start date will be considered allowable on reports, such as the quarterly report. This is to allow an early intervention specialist and case managers the ability to assist a client to obtain eligibility, such as scheduling an appointment, collecting eligibility documents, or completing paperwork to obtain an ID. Eligibility dates should not be backdated to include these services.
Now, the question is always, will this help clients? The answer is yes. Universal eligibility standardized enrollment documents across all parts, easing the burden on providers and the consumers. Eligibility reduces the burden on clients trying to access services. This means there is no wrong door for eligibility. The client can become eligible at any entry point and have access to services at all Ryan White parts. How does this work in CareWare, and how will the two CareWares interact? In the short term, Part A and B staff are helping to facilitate moving documents between CareWares. Providers in the North do not have to worry about this, as this does not apply to you. In the meantime, Part A and B staff will continue business as usual with sharing data and eligibility documents. The long-term goal is an automatic data sharing mechanism that allows data to integrate between the two CareWares. Different site types. This slide is specific to staff in the South only. Site type 1 includes providers that are receiving funding from Parts A, B, and C, which means they have access to both Part A and Part B CareWare. We expect you to develop internal processes for moving the eligibility documents into both CareWare databases as timely as possible. Site Type 2 includes Community Outreach Medical Center, or COMC. This is where agencies that are paid for enrollment through Part A and are funded through Part B for services other than eligibility fall into this category. This is where one staff has login access to get documents into Part B. Again, here we expect the transition of documents between the two CareWares, just like in Site Type 1. So the expectation is for providers funded with Part B that have access to Part B to get the information into that database. Site Type 3 are agencies that are only funded through Part A for enrollment. They do not have access whatsoever to CareWare Part B. These agencies include AIDS Healthcare Foundation, Horizon Ridge Clinic, Nye County Health and Human Services, Community Counseling Center, and UMC Wellness. There is no expectation of these agencies to enter in eligibility data because they do not have access to do so in CareWare Part B. What they do now is create an internal referral to AHN. AHN is being so gracious in getting all of that information entered into CareWare Part B.
There's some confusion as to what ADAP is. The best way to think about this is that ADAP is a program of Part B. It is not its own entity, nor does it have different eligibility requirements. It is managed by Access to Healthcare Network. The only additional information that Access to Healthcare Network will ask for outside of eligibility requirements is for the employer verification letter when a client tells you that they have health coverage through their employer, or insurance cards that a client may have through private insurance. If a client has Medicare, for example, AHN may request a copy of their card so that they can determine what amount to pay for copayments. AHN will have 3 to 5 days to process the referral. ADAP medication benefits for uninsured clients will be granted immediately until a full assessment is done, a max of 30 days. ADAP medication benefits for an insured client will also be processed immediately until the client has time to bring in their insurance documents, again for a max of 30 days. Only clients with emergency circumstances will have the ability to pick up medications on the same day as their enrollment appointment if they're currently expired or unenrolled. Anytime a provider hears of an insurance status change or a change in a life event that may qualify the client for insurance coverage, that must be communicated to AHN. This slide shows the flow of ADAP referrals and services. Not everyone is aware of what occurs on the back end with Access to Healthcare Network, and we feel it's helpful to go through that process. Once a client is universally enrolled in Ryan White, the eligibility specialist or case manager should complete the Survey of Existing Insurance Form 1610 with the client to assess their current healthcare coverage. If the client says they do not have insurance, this is a good indicator that the client may need ADAP medication or insurance assistance. The eligibility specialist or case manager will create an internal referral in CareWare B to the ADAP domain, not to the Access Healthcare Network domain directly. There's a separate domain for that. Under Part A CareWare, the referral is sent directly to Access to Healthcare Network. The eligibility specialist or case manager should attach the Survey of Existing Insurance form to the referral. Once Access to Healthcare Network receives the referral, they will contact the client for additional information in order to accurately determine the program placement for the client. Make sure to inform the client that Access to Healthcare Network will contact them for more information, so the client is aware to expect a call from another provider. Access to Healthcare will open ADAP assistance for 30 days if they need the other documents. If Access to Healthcare has received all of the other documents within the eligibility packet, then the client may go right into a full 6 months of eligibility in RAMZEL system. RAMZEL is the state's pharmacy benefit management system. Access to Healthcare makes the final determination as to which program the client will be placed. RAMZEL will generate a benefit card for the client that has all the billing information, which is a really great feature. The client will receive this card to their mailing address of choice. The next few slides indicate frequently asked questions that we have received.
Question 1 is in regards to 6-month recertification. The question is, if the consumer has changes but does not have any documents with them at the time of their appointment, can we give them a 30-day provisional enrollment status? This includes if consumer claims a loss or gained insurance coverage, or that there are changes with their address or income. The answer to this is, in alignment with the minimum documentation for provisional eligibility, Common Guidance Document 1625, the client would need to submit the 6-month self-attestation form Common Guidance Document 1546, and at least one form of residency. To complete the full enrollment process, the client would have 30 days to submit the proof of income level, additional proof of residency, and insurance information. Question number 2 is, can an eligibility staff sign the eligibility documents when a client is not present? The answer is, the Ryan White All Parts requests client signatures on all eligibility documents. This process is to protect the client and their knowledge of consent, as well as the program. However, there may be extenuating circumstances that would negatively impact a client's access to immediate medication, which allows for an exception. In cases where a client needs immediate medication access and the client is recertifying on Form 1546, not an annual application, and there are no changes, then an eligibility specialist or medical case manager may accept a verbal authorization from the client on the 1546 recertification with no changes form. A client-signed copy must be obtained within 60 days and uploaded into Careware.
Question number 3 is about proof of diagnosis. What if we have a client that has been active for years and we've never collected a proof of diagnosis? Is there a grandfather clause for them? The answer is, proof of diagnosis has always been a requirement of Ryan White. Please ensure that all required documents are in Careware before deeming a client eligible. If there's no proof of diagnosis currently on file for an active client, then please ensure one is collected as soon as possible. Common Guidance Document 1554, the Eligibility and Enrollment Document Checklist, and Common Guidance Document 1709, the Eligibility and Enrollment Supplement Guide, describes the acceptable forms of proof of diagnosis. During the client's eligibility appointment, eligibility staff should review the client's file for proof of diagnosis. Any client's record that is found to not have an acceptable form of proof of diagnosis on file should be provisionally enrolled for 30 days until an acceptable form of proof of diagnosis is submitted. In question number 4, what do I need to do if a client changes from provisional enrollment to full eligibility status and has ADAP services? The answer is, eligibility staff must send a second referral to AHN or Access to Healthcare Network. Part B provider should send that to the ADAP domain. This is to extend ADAP dates in the Ramsell Pharmacy Benefit System. Without the second referral, the client's ADAP services would end according to the original provisional eligibility dates.
Thank you so much for listening to this webinar. We hope you have learned a lot. Please remember to contact your grantee with any questions.